Personal data breach. For many years, we have often read in the newspapers or heard on TV that websites were hacked and that all the data was stolen. In general, the general public is informed several months or years after the incident, because organizations prefer not to divulge such incidents as they damage their reputation. For more transparency in this type of situation, the GDPR requires notification by the controller of the data leaks that may pose a risk to the rights and freedoms of natural persons. Data breaches include thefts but also many other situations. How does the regulation define a data breach? A personal data breach is defined as a breach of security leading to the accidental or unlawful destruction, loss, alteration, unauthorized disclosure of personal data transmitted, stored or unauthorized access to such data. Take the example of a medical center. Here are 3 scenarios that give rise to different types of data breaches. First scenario: a hacker manages to steal the patient database of the hospital and make it public. In this case, data confidentiality is compromised. Second scenario: a hacker changes the content of the medical files by modifying the blood groups of the patients. Here, data integrity is compromised. Making decisions on incorrect information is a high risk to patients' health. Last scenario: a hacker deletes all the medical files of a hospital, and the hospital has no backup. In this example, data availability is compromised. With these 3 examples, we have introduced the 3 main categories of data breaches in the GDPR. When a data breach is found, the organization has 72 hours to notify the competent authority of the breach. If the data breach may result in a high risk to the rights and freedoms of natural persons, the controller shall communicate the personal data breach to the data subject without undue delay.